Good afternoon. Myself, Varsha Gupta. On behalf of Terry, I extend my warm welcome to all to the 2021 edition of annual flagship event, the World Sustainable Developmental Summit, being held virtually under the broad theme Redefining Our Common Future, Safe and Secure Environment for All. With this, I am delighted to welcome you all to the thematic session titled Are We Really Aware About Air Pollution? Air pollution has emerged as one of the biggest challenges in India and across the world. Deterioration in air quality, diverse impact on public health and cause significant economic damage. Exposure to toxic air pollutant not only limit to respiratory and cardiovascular disorder but can even cause cancer. As per the recent report by Global Burden of Disease, outdoor air pollution is amongst the top 10 health risks in India. Despite several control measures and policy interventions by the Government of India, the level of air pollutant have remained much above the prescribed standards. While the significance of formulating effective policies based on the scientific research and assessment is undeniable, we all can agree that the role of generating awareness amongst the general public regarding air pollution as a major public health issue is also an important factor. In order to influence public discourses and encourage behavioral change at an individual level, it is required to make people more aware about the cause, impact, and mitigation of air pollution. Considering the challenge, this session intend to comprehend existing level of public perception, need for the behavioral change, and to get deeper understanding of linkages between air pollution and health impacts. Without further ado, I kindly request Dr. Sumit Sharma, Director, Earth Science and Climate Change Division, TERI, to deliver the welcome address.
Good afternoon, people. This is Sumit Sharma. I am Director at TERI, working on the field of air pollution. And this is the 20th edition of World Sustainable Development Summit. And here we are to discuss a very, very important issue on what is air pollution, are we really aware about it, and are we really aware about the impacts it is causing on human society. We have an esteemed panel with us, but let me extend a very warm welcome to all the panelists and all the participants coming to this event. Let me just try to contextualize the whole thing. We know how air pollution is caused by, contributed by a variety of energy use sources. They emit a lot of particles of different size, and we know finer is the particle, it can get deeper into our respiratory cardiovascular systems and can cause damage. There are gaseous pollutants which react in the atmosphere and form secondary particulates, secondary pollutants like ozone. So it's not just what is emitted from the source, it is what is getting formed in the atmosphere also. The impacts on human health are now these days well known. You have respiratory problems, cardiovascular issues, a lot of particles and pollutants are carcinogenic also. And these are the most deadly forms of disease we see on human bodies. Not just human health, we have seen our buildings getting deteriorated by the presence of high levels of air pollutants. Agricultural productivity. The new research is telling us that the high level of ozone formed at this level, not at the stratospheric level where it saves us from the UV radiations. But if ozone gets formed at this level, it is very, very harmful for the agricultural productivity. The research is saying that almost 20 to 30% of wheat is getting lost in the agricultural fields. Think about the misery of farmers. Think about the economic loss these farmers are going through. And the last, but probably the most important impact of air pollution is its link with the climate. We know there are particles which are black in color, which absorbs heat. While there are other particles which stop the sunlight or block the sunlight reaching the Earth's surface. This leads to change in the total energy budget, which is actually the Earth is getting, and leads to a lot of climatic disruptions. So we know that India has signed or got into an agreement with the CCAC, the Clean Climate Air Quality Coalition. And now the time has come when we synergize our efforts of air pollution and climate change control. Both the things are the two sides of the same coin. If we control air pollutants, there are short-lived climate pollutants which will help reducing the warming effect on the climate. If you go to the low carbon trajectory and help climate change mitigation, you are bound to get some co-benefits in terms of air pollution control. So I think both the things should go hand in hand, and there has to be synergies for control of air pollution and climate change. Moving ahead, just to give you a glimpse of what is happening on the air pollution front in India, this is the latest data for all different cities where air pollution is being monitored. You can see this red line, which is the annual average standard of 60 micrograms, and the blue vertical bars are the annual average levels which are monitored in different cities. Virtually wherever you go, we are not breathing air quality which is fit to this standard. And I must tell you, our standard is much, much relaxed than the WHO guidelines. So that means in most cities in country, the levels of air quality are much way above the WHO guidelines, and almost 70% are not even meeting the national ambient air quality standards. If you see the chart on the right hand side, you will see that the whole Indo-Gangetic plain, the central eastern part of the country, which has a variety of pollutant sources, adverse meteorological conditions leading to very high pollutant levels, especially during winters. That does not mean the pollution is under control in summers. It's relatively less, but it is still way above the prescribed standards. NOx is not widely violated across the country, but with the growing number of vehicles and limited controls on NOx, the levels are showing an increase in most of the cities. I must also tell you that the ozone which is formed at the breathing level in India is quite NOx sensitive. So that means if you reduce NOx, that is going to impact ozone levels tremendously. And that's playing a very important role in ozone formation at the regional scale. Well, we all worry about winter pollution, but in summers, as I said, particulate pollution may be relatively less, but ozone is something which is getting formed due to presence of sunlight, and that leads to a lot of ozone formed at the breathing level when the peak summers are there and the sunshine days are in plenty. Well, there is a variety of sources which are polluting our cities, our regions. You have industries, you have transport, power plants. A lot of people depend on biomass for cooking, the diesel generators, construction, agricultural burning happening on an episodic basis, and then ammonia and VOCs. So there is a variety of sources which are contributing to the problem. Now, in view of this, the Swiss Agency for Development and Cooperation, SDC, has initiated this clean air project in India, which is going to go on for 4 years between 2019 to 2023. The goal is to support India's efforts to improve people's health and well-being through better air quality while contributing to both environment and climate change mitigation. TERI is a leading a consortium of institutes which includes IITs, the ARAI, NEERI, and also a team of international institutes which are joining hands with us from Switzerland, including the reputed Paul Scherrer Institute. The focus of this project is in 4 cities: Lucknow, Kanpur, Nasik, and Pune. And all 4 cities are non-attainment cities. Of course, Lucknow and Kanpur are much more polluted, but that does not mean Nasik and Pune are less polluted, and there also we need a lot of interventions. The broad 2 components of the projects are these. We have a research team led by Paul Scherrer Institute, IIT Kanpur, IITM, and they are all going to use the state-of-art measurement techniques to know what are the sources of particulate matter and its health relevant components. So this new science is telling us that not all particles are equally toxic. There is a component of PM2.5 which is much more toxic than the rest, and that is what they are going to focus upon. As lead to the implementation part of this project, we are working with the pollution control boards to strengthen their air quality management plan to demonstrate the strategies through pilot scale projects and to build their capacities to reduce air pollution in the 4 cities. The 3 broad outcomes is to improve the overall data measurements and overall understanding of the sources and the contributors. The second is to build capacities of the city and state level authorities to strengthen their clean air action plans. The action plans are there, but they are not yet prioritized in terms of different strategies and their potential for control. So we need to strengthen them on the basis of scientific analysis. The third aspect, but the most important aspect, is to generate awareness for clean air action. And that is what the topic of today's webinar. We have been working in a number of all these 4 cities where we are conducting awareness and capacity building programs for media, for students, for the pollution control board officials, the industry people, to sensitize them on this such an important aspect. And that's where I wanted to contextualize this, that there are different stakeholders which are involved. There is government, there is academia, there is NGOs, and they all have responsibilities. Government has the responsibilities to regulate, to put standards, to enforce, to implement policies which are required for control of pollution. Research fraternity, the academia, has the responsibility to provide relevant research inputs to these policymakers. NGOs has the responsibilities to raise awareness, to basically push the agencies to do what they should be doing. But I think the most important aspect of this lies on the individuals. What is the responsibility of an individual in this whole aspect? The 3 questions which I'm posing for all of us, for you, me, and everyone, is this. First is, are we really realizing the enormity of the issue? Do we know how impactful this pollutant is? How do we know all different types of pollutants which are existing and how they are impacting our daily lives? The second is, if we are realizing, are we really aware to take enough actions? I think that's the next step, that we do we know how much is this? How can I control? What will be my contribution in the overall aspect? And the third is, am I really taking actions for control? If I am realizing it, if I'm fully aware of this, am I really converting those thoughts into real actions? I think this is what we are talking about here in this session. And that is why we have a very interesting panel in place. We have students from these cities. We have a teacher from there. We have a media personality. We have 2 very eminent doctors with us who are going to talk about the health aspect of all this. And then we have a behavioral change expert who is going to talk about how behaviors can play a very important role. So with this, I welcome the whole panel, all the participants, and I hope we'll have a very scintillating discussion on this aspect. Thank you, Varsha. Over to you.
Thank you so much, sir, for your insightful welcome address and setting the context for today's discussion. Now, I kindly request Dr. Jonathan Demenge, head at Swiss Agency for Development and Cooperation, India, to give the inaugural remarks. Over to you, sir.
Thank you very much. Thank you. Good afternoon, everyone. Thank you also very much, Mr. Dr. Sharma, for this very good introduction. You're making my work much easier. Respected professors, doctors, teachers, students, panelists, and public, it's a true honor to be here today with you at the World Sustainable Development Summit with such eminent personalities and interesting people. And it's also a privilege to be able to address such an important topic that affects all of us collectively as well as personally. So let me start with a provoking question now that the stage has been set. If a single cause led to more casualties globally than tobacco use, than alcohol and drugs, than HIV/AIDS, than malaria, than TB or war, shouldn't it be addressed as an emergency? Shouldn't it be treated as a pandemic? So based on studies and reports, an estimated 5 to 8 people die of premature death as a consequence of air pollution worldwide. It is truly a global issue. According to the European Environment Agency, the number of premature deaths in European countries due to air pollution is more than 400,000. Although the number has dropped by 500,000 since the 90s, it is still an issue. And in Switzerland, air pollution is responsible for 4,000 premature deaths annually. Even in Switzerland, a country known for its spotless free streets, clean waters, immaculate mountains, and blue skies. And there are cities in Switzerland, in Europe, and in India are developing and implementing plans and policies to act on air pollution, such as the National Clean Air Policy. Why am I giving you the statistics? Not to stoke fears, but because we can and we must act on air pollution. And together, we have the means to do so. Beyond statistics, there are personal stories. There are stories, your stories, of children with asthma, people with pulmonary disease or strokes. We are trying to protect ourselves, our elders and children, carefully monitoring air quality indexes and sheltering ourselves behind pollution masks and air filters, and telling our children not to stay indoors instead of going outside and exercising. Not every youth will become Roger Federer, Kapil Dev, or Vikrant Gupta. But what happens when exercising and breathing becomes unhealthy, when one has to live indoor? When something as fundamental for health, for growth, for life balance, and personal development becomes constrained? And air pollution is a distributional issue as well. It is an issue of social justice. I know I'm privileged. I'm comfortably sitting next to my air filter right now with an AQI of 24. Yet I know that the electricity that powers my air filters comes from coal burning and therefore contributes to air pollution. I also know that not everyone has an air filter and can afford clean air, because depending on where you live, depending on whether you can close your windows tight, depending on where you go to school or work, depending on whether you have access to clean fuel, depending on what you earn, not everyone is able to protect himself or herself in the same way. And many people also have much bigger concerns in life, immediate concerns, than air pollution. Yet in the end, in one way or another, every one of us gets affected. Clean air is one topic the Swiss Agency for Development and Cooperation, or SDC, works on, as mentioned by Dr. Sharma. It's a hugely important topic for SDC, and SDC has been involved in for quite some time in India, but also in China and in Latin America. In Mexico, Peru, Colombia, and Chile, the Climate and Clean Air Program, for instance, works for black carbon zero cities that are healthier and more sustainable by fostering change in urban buses and off-road machinery that is soot-free and low in carbon emissions. And globally, Switzerland has become a world leader in these issues through the Climate and Clean Air Coalition, CCAC, which India has also joined 2 years ago in January 2019. So Switzerland has been working in India for more than 60 years. Together with the Indian government and with Swiss and Indian partners like TERI, SDC works to promote low carbon development because climate change is a reality. And we need to act globally to limit our greenhouse gas emissions to contain the increase of temperatures as much as we can. And that is why we have projects on developing low carbon cement, on energy efficiency in buildings, on renewable energies in buildings and in agriculture. And the Clean Air Project is also one of them, because greenhouse gas emissions, black carbon, air pollution are all linked, as mentioned Dr. Sharma. And because one cannot ask people to act on climate change unless immediate needs such as clean air are not fulfilled. And SDC also works on climate resilient development. How can we make communities, cities, and states more resilient to the impacts of climate change and natural hazards? For instance, we work on climate adaptation plans for cities. And we work with the Indian Himalayan states to monitor, understand, prevent, and manage disasters like the floods and debris flows that created havoc and have taken too many lives in the Chamoli district of Uttarakhand earlier this week. So Clean Air Project India, or CAP India, is one of our flagship projects. We work to strengthen Government of India's efforts in controlling the air pollution in 4 non-attainment cities mentioned by Dr. Sharma: Lucknow, Kanpur, Pune, and Nashik, and we help them achieve their clean air targets. The project is implemented by a large consortium led by the Energy and Resource Institute and by the Paul Scherrer Institute in Switzerland. along with Automotive Research Association of India, IIT Kanpur, the Indian Institute of Tropical Meteorology, and the National Environment Engineering and Research Institute, NERI, among others. So what we do, I'll go briefly on that because it has been explained, but we work on improved data measurement and analysis on air pollution, because we need to understand the scale of pollution, the type of pollution, and where the pollution comes from. In CAP India, Indian and Swiss scientists work in collaboration. The knowledge is co-produced. We build on the strong body of research conducted by Indian scientists in India already since the 50s and 70s. And leading techniques are being used and developed to produce state-of-the-art data and peer-reviewed research. Second, we work to enhance the capacities of cities and state authorities to implement clean air policies and action plans. Knowledge needs to be translated into policies, and policies have to be implemented and turned into action. And since the Air Act of 1981, some action has taken place. And the National Clean Air Program of the Government of India has set the goal to meet the interim target of 20 to 30% reduction of PM2.5 and PM10 concentration by 2024. This is an interim target, not an end target, just to show that we can reverse the trend. And more than 2,200 crores rupees have been allocated for this in the last budget, and they should be used. So together with pollution control boards of 4 cities, CAP India is working on reaching these targets. And third, we work on awareness for clean air action, because public awareness is essential. You are essential. And this is the reason why we are here today. We need to be conscious of the issue, and we need to work together for solutions. So here comes my 2 messages. Like for climate change, we do not need one solution, but we need thousands of solutions. And solutions require changes in individual behavior, as we will discuss today. Solutions also require collective action in our neighborhood, not tolerating dust in our street, demanding that green waste are composted rather than burned, for instance, setting safe walking and cycling lanes. And if somebody leaves his engine running for 10, 20 minutes next to you, you're entitled to ask him to switch off, because this is the air you breathe. And solutions require supporting the politics when they act and demanding action from our politics. And my second message is actually a question. Is there any trade-off between development and air pollution? Should we first focus on development and then clean air? And I think the answer is no. Because pollution is detrimental to economic growth, as mentioned by Dr. Sharma. For instance, in India, fatalities in 2019 led to a total loss of $36.8 billion, or 1.36% of India's GDP, according to the Lancet. Then, because clean air is constitutive and conducive to development. And to borrow from Amartya Sen's approach to development as freedom, and in the capabilities approach, freedom from needs, freedom from pollution are constitutive of development. Can we even talk about reaching development when the air is too polluted to breathe? Clean air is also conducive to development in the same way that nutrition, access to education, will enable our children to develop their future capacities and their future capabilities. Clean air is essential to develop their capabilities and to build future development. So to conclude, clean air is a common good. We are all responsible for it, and we are all entitled to it. So to borrow from another great Indian thinker that I don't even need to name here, let's be the change we want to see in this world. Let's act for change, let's ask for change, and let's make that change happen. Thank you very much.
Thank you, sir, for giving the insights about CAP India project and your inaugural remarks. Now I kindly request Ms. Neha, Fellow, Environmental Education and Awareness Group, TERI, to give us brief about the awareness component as a part of CAP India project. Also, I request her to announce the winner of poster making and resource mapping competition. Over to you, ma'am.
Good afternoon, everyone. It's such a pleasure to be at this platform. As you heard Dr. Sumit Sharma, that he mentioned that awareness component is one of the major component of Clean Air project in India. And he also mentioned that we have students with us in this thematic track. So you must be wondering why students. You know, students are one of the most significant building blocks of society. They are an important source of creativity and enthusiasms and a driver of social change. An environmentally conscious society can be created only if the students are empowered with sufficient knowledge, skills, attitudes, and values. The awareness component of Clean Air Project India aims to create awareness and build capacity in students of Lucknow, Pune, Nasik, and Kanpur on issues related to air quality so as to enable them to comprehend their relationship with nature in order to facilitate improved standards of living. We have students from government, private, and public schools from classes 5th onwards. The project commenced with reviewing the scope of knowledge of the students on general environmental awareness with focus on air pollution and its impact. Various activities such as interactive sessions, competitions, informative source, mapping, action projects, etc. will be organized under this project. As part of the project, inter-school competitions on poster making for students of classes 5th to 8th and resource mapping for the students from classes 9th onwards were organized to understand their thoughts and observations related to sources of air pollution in their neighborhood. Mr. Jonathan, as you mentioned, that it is essential for the students to bring about a change and adopt some individual behavior which they can do and bring about a change. That was one of the thought we thought, let us conduct a competition and understand what are the thoughts behind the students and how do they observe the various air pollution sources in their neighborhood. It was heartening to see that the students not only understood the sources, but were able to capture them creatively. We had received more than 250 entries that were judged by a panel of experts, including subject technical experts, designers, child creativity, and experts from NCERT. The panel evaluated the entries on content, creativity, innovative presentation, and originality. Today, during the thematic track on Are We Really Aware About Air Pollution and Its Impact? As part of the virtual WSGS 2021 session, we are pleased to announce the winners of the competition. I request Varsha to please share the screen. So, announcing the results of the poster making competition first, the third rank goes to Vamika Gupta from class 5, City Montessori School, Lucknow.
Is the screen is visible, ma'am?
It's visible, but yes. The second rank is shared between two students, Miss Atharva Mishra and Janvi Mishra. Atharva is from Pune and Janvi is from Kanpur. Both of them are from class 6 and 7 respectively. The first prize is Varsha, next slide please.
Yeah.
The first rank holder is Miss Anushka Nikam from class 6, the Lexicon School, Pune. Coming to the winners from resource mapping. These are the students from classes 9th onwards. We have a special appreciation prize for Noreen Ali. Along with the snaps of the photographs, we are displaying the images of the posters and the resource mapping that were developed by the students as part of the competition. The third prize was goes to Vaibhavi Balkrishna Kunja from class 9, Pune. The second rank goes to Lavanya Jat from class 10th, Kanpur. And the first prize goes to Krishya from Pune. Congratulations to all the winners. We are regularly posting all these activities on our Facebook page, and all the winners will also be acknowledged on the Facebook page. So please keep tuned to this page and keep participating in different competition and take a benefit of interacting with the experts through this platform also. Thank you so much.
Thank you so much, ma'am. Now, moving on to the technical session, I kindly request Dr. Sumit Sharma to moderate the session, introduce our esteemed panel of guests, and take over the proceedings. Thank you, sir. The floor is all yours.
Thank you, Varsha. It's a pleasure to moderate this panel of esteemed speakers. As I said, it is a very interesting panel of, a very good mix of different kinds of people from different age groups, from different fraternities. And I'm sure we are going to have a very scintillating, a very exciting discussion on how and what is the state of awareness on the air pollution and its impacts. I will introduce the panel. We have two students from the City Montessori School from Lucknow, Mr. Naman Sahani and Anshika. I will start with them in a while. But we also have Professor Randeep Guleria, who is Director AIMS and who needs no introduction. Professor Arun Sharma from University College of Medical Sciences with us. Professor Archana Kumar, who is a renowned behavioral change expert, associate professor from Lady Irwin College. Mr. Vikrant Gupta, who is a senior executive editor with TV Today and Aaj India Today channel. He's a renowned media personality. Mrs. Archana Khanna Chabra, who is a teacher from Purn Chandra Vidya Niketan School in Kanpur. And I must say that I'm definitely very excited to hear different kinds of perspectives coming out from all these people. I'm just starting the discussion with some statistics which came out of our initial assessment with the school children in Lucknow, Kanpur, and Pune. What we found is that almost 60% of people were aware. I mean, we only surveyed school children in this. So when I say people, I mean school children. So 60% children were aware of different types of health impacts of air pollution. Well, that's quite heartening that at least 60% know about it, but then rest 40% are still lagging behind. 46% of students in these three cities knew about what air quality index is. Now that's again heartening that at least 46% know. But then the depressing part is that 54% students did not know what air quality index mean. Almost 60% of people did not know what is the limit value, what is the average standard value, daily average standard value for PM 2.5, which is such a potent pollutant. Almost 53% student did not know that the size of a PM10 particle is smaller than a human hair. Just few pointers to start the discussion. Let me first of all call upon Naman, and he's a student from school in Lucknow, a very bright student. And let me first hear to his young mind what he feels about air pollution, what is his perspective, and where are we going wrong. Go ahead, Naman.
Thank you, sir. Good afternoon and Jai Jagat to one and all present here. I'm Naman Sahani, a student of class 7H from the City Montessori School, Aliganj Campus 1, Lucknow. In my opinion, air pollution is a great threat for all of us. What if I get up tomorrow morning and the level of air pollution is so high that I'm not able to adapt to such level of air pollution? Or what if all of us get affected by fatal lung disability? Life on the earth is negatively affected by air pollution in a billion ways. Chronic diseases, respiratory disorders, heart attacks, and what not can this threat cause? Air pollution directly imposes the threat to the existence of life on earth. I, at the age of 12, am scared of going outside, breathing in this polluted air, the air which can affect my physical and mental growth, the air which can ruin my life. If I talk about the current scenario, I don't think that there's much awareness. We cannot call the society aware if only one of its parts is aware. 2 3 hours ago, I myself smelled the polluted air coming from the garbage being burned next to my house. I know what all will think that I should have warned the garbage picker or at least have made him understand that what he was doing was wrong. I have done this around 1,000,000 times already. But who takes a 12-year-old child seriously? No one cares. Similarly, I got stuck in a traffic jam today. None of the people switched off their car engines even when their cars were at halt. All the vehicles had their engines turned on and were contributing to high levels of air pollution with no reason and were also wasting fuel. Most of the people knew the fact that the engines of the cars were on. However, they were not aware what they were doing can be hazardous and threatening to their own lives. Awareness, in my opinion, will come when the facts are made clear to all and sundry. Awareness will play a major role in reducing the high amounts of air pollution. What lacks here in India, which is contributing more and more to the rising levels of air pollution, is lack of literacy and lack of awareness. I haven't ever seen my father burning garbage out in the open, or my friends or my teachers doing so. Why is this? Are these people special? No. This is because all of them are aware about the fact what a big of a threat air pollution is, how they can affect their lives. So when the people will understand the negative impact of air pollution on them, their children, their life, this is when they'll realize how big of a threat it is. Then they'll be serious about all the facts. The impact of air pollution in my city is that there are many new diseases being spread in my city which weren't that common when the air pollution wasn't so high. When I breathe in the air, I can smell the air pollution. The polluted air, the polluted air can affect children's minds in very and can have a very bad outcome in their physical as well as their mental growth. I, as an individual and as a 12-year-old child, have a number of ways in which I can do my bit, my part to save the Mother Earth. I can associate myself with projects like Terry to keep myself aware and updated about what is the condition of different international causes. I can spread awareness and information which I learn. I can advise my parents, educate the people around me in the rural areas, and inform all the people around me what a big of a threat air pollution is. The earth has given me a lot, and it's my turn to heal its wounds. And I won't back off. I, as an individual, will be contributing in solving an international cause. What not can be done if all of us join our hands together, and when we're united, we'll surely be able to fight this cause and the world will be back to normal again. This is what all I have to say. Thank you and Jai Jagat.
Thank you. Thank you so much, Naman. So articulative, very clearly pointing out the scares around us, the sources of pollution, and the impacts they can cause to all humans. Also, the right appeal to come together and solve this problem jointly. Let me move on to Anshika, the other young kid in the block. Anshika, your views about the issue. How do you see this problem? All yours for next 2 to 3 minutes.
Air pollution is a huge threat to all of us. Air pollution is the presence of substances in the atmosphere that are harmful to the health of all living beings or cause damage to the climate and materials. Some of the air pollutants, such as gases, are carbon dioxide, methane, and sulfur dioxide.
Okay. Thank you, Anshika. I know. I think you wanted to raise some voice on the types of pollutants, and it shows the level of awareness you have on these pollutants. Let me now move on to Professor Guleria, and as I said, he doesn't need much of introduction. He's a known pulmonologist and a specialist on sleep disorders. He has a lot of book chapters and articles to his credit, and he's a Padma Shri awardee, we all know, and also awarded with the prestigious Dr. B.C. Roy National Awards for the year 2014. Dr. Guleria, my question to you is, how do you see air pollution become increasingly a major concern for our respiratory and cardiovascular systems? Where do you see this going? you are dealing with patients, and the whole country relies on your advice, your perspective on how this problem can be resolved, what kind of cases you are seeing, and where we are heading to. All yours, sir.
Thank you very much, and thank you for inviting me. I think air pollution is something that we need to address, as has already been said, on an emergency footing. It is a global and a national emergency. If you look at the recent state of global health paper on air pollution by the Health Effect Institute, it calculated that in 2019, we had almost 6.67 million deaths that could be attributable to air pollution. And even if you look at the burden of disease paper, which was published in 2018 in the Lancet, which looked at the burden of disease due to air pollution in India, it estimated that 1.24 million people died in 2017 because of air pollution, both indoor and outdoor air pollution. So air pollution is a bigger threat. As a matter of fact, if you look at that paper, it actually also shows that if we look at what we call disability adjusted life years, for respiratory problems like low respiratory tract infection, COPD, and heart diseases, air pollution was causing more disability than even the use of tobacco. So that paper suggested that in our country, air pollution has become a bigger threat than the use of tobacco. We have a very aggressive program for smoking cessation, but we don't have an aggressive program when it comes to air pollution. We had conducted a study which we completed in 2019 or early 2020, where in Delhi, in 5 hospitals, we looked at emergency admissions throughout the year for 2 years, and we linked that with air quality index of where the individuals are coming. And we were able to show that in children and in adults, whenever the air quality worsened in the following 5 to 6 days, there was a spike of hospital visits in the emergency and admissions in children and in adults because of acute respiratory problem. And this was directly linked to air pollution. So there is a lot of robust data which is present as far as India is concerned. I'm very happy to see the work that you're doing. Almost 5 years ago, I had started an initiative with Delhi University, Shri Venkateshwara College, which we called the Green School Initiative. And we were going to various schools to really improve the awareness on air pollution and help children decrease their carbon footprint. And we felt that children could be messengers of passing on the message to their parents, to the adults. We used to distribute a booklet to them. We even, I had a PowerPoint presentation or a story which I would tell to them to make them understand the importance of air pollution, about a boy who came from a hilly area of Himachal, which had very little pollution. His father got posted to Delhi. He started staying here, and how he started developing respiratory problems. And I think there was a lot of awareness in children. But how to really translate it to the next level is something that we really need to understand. And that, I think, is very, very important. The challenge that I feel is, and I've been talking about air pollution maybe now for about 20 years, we saw this in 1998 in Delhi. There was very poor quality air. Then we had the whole change of CNG, and everyone said CNG cannot come. It will be very difficult to have cars running on CNG. It will fail. But CNG worked. And for a few years, we had good quality air in Delhi. But somewhere around 2005, 2006, again, because of a large number of diesel vehicles, again, construction going on in a major manner, we started seeing rising levels of air pollution in Delhi. And we're actually now having air quality which is even worse than what we had in the pre-CNG era. And therefore, I think it's important for us to understand. The challenge that most of us need to understand, which I feel, is that air pollution is what I call a silent killer. If we have someone who dies of COVID-19 today, we will know definitely how many people died of COVID-19. If someone died of dengue, it would be big news that so many people have died in Delhi because of dengue, and we need to do something about mosquitoes. But the issue is, how do we designate, how do we say that X or Y who came to the emergency, who had bad lungs or had a heart problem, died because of exposure to air pollution? So we are not able to really convey that message strongly, because the fact that the air pollution causes an indirect effect as far as health is concerned. And this is something that has been seen not only now in the 50s. In London, we had the London smog, which suddenly in a matter of just 7 to 10 days saw a certain burst sudden increase in the number of death of around 4,000, and that really woke people up. And that's what led to the Clean Air Act, and now you have good quality air in UK, and both in London as far as the air is concerned, or as far as the water is concerned. The Thames was also cleaned at that point in time. So there has to be a sort of, I would say, an interaction and alignment between policymakers, health individuals, and people who are the source of air pollution, the emitting sector. Unless they all get together and work and understand the problem that we have, we're really not going to be able to move forward. And finally, I'd just like to add that I think the concept of One Health is very, very important. And what do we mean by One Health? When we're talking of health, it's not only human health, it's animal health, it's plant health also. And that One Health has become more important now because if you look at viral infections, even COVID-19 is something which has come from bats to humans. And therefore, having a concept of One Health is also important for air pollution. You touched it in the beginning, but there is now data which shows that, and we've collaborated with certain institutes where we've shown that even in plants which are close to main traffic areas, the quality and stress in plants is much more than what it is in, let's say, areas where we have a lot of greenery or which are designated forest areas. And we're trying to do a study. We're trying to see what happened to the stress in plants during the lockdown, because air quality improved then. And it would be interesting to see that. This is something which is being done with Delhi University. But that was a natural way of clean air for some time. And we could see what is happening as far as plants are concerned. But I think it's important for us to look at health holistically, not only human health, but animal health and plant health also. Thank you very much.
Thank you so much, sir. It was, eye-opening for many of us. I mean, you clearly established that link that whenever there is a spike in air pollution, you could see the increase in hospital admissions. You talked about lockdowns. I must, share my research on this. Our research is saying that almost 30 to 60% times, even during the lockdowns, we were not meeting the standards in Delhi, especially during the second lockdown. So that's the state of air we are living in. So, but the point is well taken that we need to talk about health of people, health of animal, and a whole ecosystem as one, and that is where the focus should go on. Let me move my attention to our next speaker, Mr. Vikrant Gupta. He has passed out from Punjab University. He did mass communication and journalism. He's a celebrity, I must say. He's a renowned media personality working in India Today as the news channel. He's covering sports. Let me ask him, as a citizen of this city, what you are seeing, Vikrant. Where are we heading? Media has a role to play, right? Media can change minds. Media can change perceptions. What is media doing? What do you see as the role of media in making perception about changing the air quality scenario in the city of Delhi and whole as the country?
Thanks, Dr. Sumit, and a big afternoon to all the panelists, renowned doctors also. I think it's not just the media, it's the social media as well now. I think the social media drives our country now, and it's the scare stories that sell the most. Like Dr. Guleria was saying, and we've been listening to him almost every day for the last 1 year because of Corona and the pollution. I think only when people realize that it is me and my family who can be affected do we realize the gravity of the situation. I've been a Devanand fan all my life, ever since I was a child, and I spent my childhood in Chandigarh. And obviously, 80s and 90s were very cool in terms of the air quality. I came to Delhi in 2003. And since I was a fan of Devanand, I wanted to be like him, evergreen, all my life. I don't think any one of us can now say that we can be evergreen all our life because of the external factors, the environment and everything. I not just the media, as somebody who's living in this city, I just want to ask one thing from everybody. Why is it only during the 4 months, beginning October till about January end or February end, do we talk about pollution? Why is it when the air quality gets better in the summers, do we forget about everything else? I shifted to Gurgaon in 2004-05, and that is, like Dr. Guleria said, when construction was at its peak. And my elder son was born in 2004, and he would have these respiratory problems. So every second week, we'd be going to the doctor, some allergy or the other. And fortunately, he grew up. But the fact is, am I okay? Is my family okay? I don't know what are the parameters. We look at our elders, look at our grandparents, the parents. They are fine. They're still doing fine. And I look at somebody like Saurav Ganguly, for instance. Obviously, Saurav Ganguly's medical condition is not related with pollution, but it is maybe related to the society that we live in. He's 48, he's my age, fit, fine, he runs, he does everything, doesn't eat much. All of a sudden, we realized that he had a mild heart stroke. So 3 of his arteries were blocked. 2 months ago, Kapil Dev had the same thing. So maybe it is also part of our lifestyle. I have 7 air conditioners in my house, not a big house, but everybody will have 6 or 5 or 7 air conditioners in our house. We need them. But do we really care for the neighbor? Do we really care for the society? We don't. And let's be very honest. We think, yaar, mujhe kya fark padta hai? And it's during the lockdown and the last year, 2020, when all of us realized the value of nature and life. During the lockdown days, you could see, even during the day in summers, you could see a blue sky. At night, you could see stars. My kids would have never seen stars in their life. When I was younger and I would go to my grandparents in Jalandhar or Amritsar, we would sleep on the terraces and we could see everything. We could see the stars and everything. We could count the stars. But this is the first time my kids would have actually seen stars, as in stars. So I don't know. The media will have a role to play. The social media will have a role to play. But I think we need to further amp it up. It's only during those 4 months do we realize the gravity of the situation. Otherwise, we all say, "Sab kuch theek hai," and that is something we've got to come out of. Maybe next month or air pollution theek ho jayega, and we'd say, "Yaar, ab to COVID bhi theek ho gaya hai," and we'll lower our guard. I mean, Dr. Guleria, thanks to him, Delhi had no fatality yesterday. And while I was driving to work, I could, for the first time, see many people in their cars without masks. I mean, it can come back. It's the same with pollution. I remember 2016 was very bad. I was playing a game in Terry itself in November, and I could not see the ball. My eyes were burning. And then that was, I think, the first time they had this 15 it was, the odd even thing. But wo bhi khatam ho gaya. So I think on a larger scale, we need to have a long-term vision. This can't happen overnight, but it has to start now.
Thank you, Vikrant. You took us to the golden
days.
If
you don't mind, can I take your leave? I have a show. If you don't mind, please.
Sure, Vikrant. You have made your point.
Thank you. I'm very sorry, Baki. I won't be able to be a part of this. A big note of thanks to all the esteemed panelists. In fact, I was the one who's not qualified enough, and I was desperately wanting to listen to everybody. But unfortunately, sir, I have a show to attend to.
Thank you so much, Vikrant, for your comments and the comment you made about the seasonality, the work which is to be done in summers for preparation of winter's pollution is extremely well taken. And thank you so much for being with us, Vikrant.
Thank you, sir. Thank you.
Let me now move on to Professor Arun Sharma. He's a director professor in the Department of Community Medicine, head of the Department of Biostatistics and Medical Informatics at University College of Medical Sciences. He has been awarded with so many things. I'll not repeat it here. But I must say he's a very energetic speaker. Whenever I listen to him, I would like to listen to him. So, sir, what is your opinion? You are dealing with patients. You are doing a lot of studies which are epidemiological in nature. What is your take on this? How do you convince a patient that the exposure you have had is not just because of smoking? It could also be the environmental factors which all of us are contributing, because that is the point when he or she will realize that he or she will need to contribute to reduce this exposure which is making them ill. Over to you, sir.
Well, good evening, everybody, and thank you, Dr. Sumit, for having me in this group. And I think you have put a very challenging question to me. And before I answer that question, please permit me to say a few things. Number one, that I am from public health background, and I deal with epidemiology and field-based studies, and I do not see patients per se. Unlike Professor Guleria, who is a pulmonologist, and he has the business of looking at patients directly. But being a public health person, I look at the entire community in a perspective of interaction between different factors and occurrence of disease and methods of preventing it, right? So probably to the first part of the question, that how do I convince my patient, I will not be able to answer because I am not directly seeing patient. But being an epidemiologist and conducting research in the field of environmental health since last 15 years, I have developed my own understanding of the issues, challenges, opportunities, and threats. Right. So the most important point after listening to starting from Naman and Anshika, and such intellectual and serious input from Professor Guleria, I want to draw your attention to a very different perspective altogether. The perspective is that we understand the data, we understand the values, that yes, air pollution is bad, air pollution is detrimental to health. Previously, we were talking about human health, and now we have started talking about its equally detrimental effect on the animal health, on the plant's health, and thereby we say health of the planet. So here comes the role of the public health expert or public health fraternity to bridge the gap between a clinician's perspective and a patient's perspective, join the two and look at the public health point of view. Now, having said that, my contention will be that when we talk that are people aware, the level of awareness varies. A person who's already suffering from a disease called COPD, chronic obstructive pulmonary disease, or suffering from bronchial asthma, he has visited a doctor who has told him that you have got this disease because either you are a smoker or you have been cooking on biomass fuel in your household, or that you are exposed to very high level of air pollution through the entire life period, because probably you are living in Delhi, or you are commuting on a motorcycle, or you are working in a very polluted environment. Now, he comes to know when he has developed the disease after being exposed to all these risk factors for 15 to 20 years in his life. And that is unidirectional. You cannot undo that. And neither can you do anything to make that person come back to pre-disease status. This is the problem. A person who suffers from COPD, a person who suffers from bronchial asthma in the later part of the life, no matter what treatment you give, he's not going to get back to the normal state. Right. So what is required? What is required that in spite of presence of these disease conditions, how best he can make of his life. And how to do that? That further exposure to those risk factors, be it smoking, be it pollution, or be it exposure to the biomass fuel, further exposure to these, if protected from, if prevented, then the person's deterioration of health will become slower, right? Or it may be arrested, but it cannot be reverted. This we have to understand. So that becomes a very important lesson for the rest of the population who are allowing themselves to be exposed to these risk factors and moving towards becoming diseased with these conditions in subsequent period of life. And this is not restricted to respiratory health. Now the knowledge is that pollution affects almost every body system. We develop diseases of the brain and mind. We develop diseases of the heart. We can develop diseases of the kidney. We can develop diseases of the skin because of exposure to different pollutions. This depends on what? That is what probably Anshika was trying to say. And we know through our understanding that what is the components which are constituting the pollutant. Is it the volatile organic compounds? Is it the toxic gases? Or is it simply the particulate matter, inert particulate matter? So the nature of particle will decide that what kind of disease it's likely to cause in that particular person. Okay. And since it's always a mixture of different pollutants in the air, the disease one can get cannot really be 100% predicted through mathematical modeling. That okay, if you live in Chandni Chowk area and you are breathing this air, then after 10 years you will develop COPD. Or if you are living in, for example, South X and you are breathing this kind of air, so you are going to develop heart attack. No, that kind of a mathematical modeling is not possible. What we have to understand that pollution per se is harmful. It is going to cause affect the health adversely, and it will manifest in some disease or the other. Right. Now, the challenge that remains with us are two-dimensional. The first dimension is, as the impact is happening slowly, we are not able to recognize, as it was said a little earlier, that had it been COVID-19 death, we can see the immediate effect that a person got affected yesterday and within 5 days he deteriorated, he landed up in the intensive care unit and probably on the 10th day he is no more. So we could directly see a relationship that how serious effect of COVID-19 is because the duration is short. But when in pollution or smoking for that matter, the duration is so long that we are not able to register the seriousness of it. That is where the challenge lies in preparing our pollution to fight, preparing our population, our citizens to fight with pollution. Having said that, I want to come back to another important issue, which I am sure Professor Archana is going to take it more in a more detailed manner. I'm sorry for transgressing her into her area, but my gut feeling is that the key to the problem lies in behavior change communication, because awareness is there. Even if you ask a rickshaw wala or an auto driver in the city, he knows कि हाँ हमारे शहर में बहुत pollution है और हम प्रदूषण में रहते हैं. लेकिन the next question is क्या करें? Everybody asks that question, what can I do? And probably the answer lies within itself. The answer is what can I do? Not that what can government do or what can scientists do. The answer lies in what can I do? Let me find out how much I can contribute to removing this pollution and make my life healthier. The second point is when Mr. Vikrant Gupta said that it is 4 months seasonal. He is not there anymore in this particular program, but still I want to say that for this, the responsibility lies with the media. The headlines about pollution start appearing in the end of October. They grab larger space of our audiovisual media or printed media for the month of December, January. And the blame equally lies on the media for forgetting it and finding newer and other relevant stories in the month of March, April, and May. So the second part to this answer is that the scientists, the doctors, and all active people are fighting pollution day in and day out. TERI does not stop working on pollution issues after February. Dr. Guleria does not stop seeing patients of COPD after February. Or I, for that matter, do not stop conducting my research after February that now pollution is over. Let me move to nutrition. Let me move to some other disease condition. No, it's only in the public space that the talk of the town moves from pollution to other issues when February or March is over. So the correction needs to be there. The correction has to come from there. That the collective responsibility shared by all stakeholders need to be perpetually taken up and should be addressed simultaneously throughout the year. The media also need to continue to engage with the stakeholders throughout the year and not in those hotspot months, if I can say, on the temporal line. I will not take much more time. The only other point I want to make as a health specialist is that our knowledge so far had been restricted to what patients we are seeing in the hospital. We have conducted a study in the last 3 years where we actually went door to door in Delhi. We covered 8,000 households and roughly 40,000 population in different land use pattern and different living conditions of the city. That means we went to a high income group society, we went to a middle income group society, we went to the low income group society, we went to the industrial area, we went to the designated rural area, and also to the slum areas to find out that our patients of chronic obstructive pulmonary disease, are they uniformly distributed across the city, or there are pockets in which there are more number of people who are suffering and there are pockets in which less number of people are suffering. We did this study. Our report is ready. We are only waiting for clearance from Department of Health Research, which is the funding agency for this project. The moment we get clearance from that, we will release it in public. And I want to tell you that we need to take this discourse now to the community. We need to talk to the people in their living conditions and point out to them, look, what's wrong in the air that you are breathing and how you can contribute to improving that air locally, not for the whole city, because it is not a uniform problem across the city. The problems are of different nature in different parts of the city. I will not take much more time. I'll stop there. If there are any specific questions related to public health and air pollution, I'm ready to answer that. Thank you once again for giving me this opportunity.
Thank you, Tom. Thank you so much, Professor Sharma. I think the point related to the seasonality of the problem, I think the point lies there that the acceptance has come that 80 microgram or 90 microgram is good if you compare it with 200 or 300 or 400 in winters. Now that needs to be broken. This myth needs to be broken that in summers we are within the standards. We are not meeting our national ambient air quality standards, which are much relaxed than the WHO guidelines. I think that is where the crux lies, the invisibility of the problem in summers.
Yeah.
It is still there. The particles are still there. The gases are still there. In fact, ozone is much higher in summers than in winters. So, that myth needs to be broken. Absolutely right. Let me move on to our next speaker, Mrs. Archana Khanna Chhabra ji. She's a teacher by profession, a counselor and environmentalist by compassion. And, as she said, she's a teacher by hobby. So over to you, ma'am. My question to you is, what do you observe in the children? What is the level of awareness you are seeing in the children? And what do you think could be the changes in our education system to make them more aware, to make them the concepts need to be more robust in their minds, so that when they go out in the real world, they act as green warriors and support the cause.
At first, good afternoon, everyone. And since I'm a teacher and I remain with the students most of the time, I find that it's a great threat, not for children only, but for animals and for buildings, for plants, for everything present on the planet, as somebody said just now. And earlier, I remember that I used to find 2 or 3 students in whole school suffering from respiratory diseases. Now I see 2 or 3 children in every section of the class, which indicates that patients means number of such type of students are increasing day by day. They are not able to give their best. Their health is deteriorating. They are not able to play. They are not able to give whatever they actually want to give. We all know that we can live without food and water more than 8 days to 1 month, but we cannot survive without air for more than 2 minutes. And this is such an important factor, and we need to control this. And if we do not do this, a time is going to come when students will carry an oxygen cylinder at their back. And you think of that situation, how troublesome the situation would be for the students. And if you talk about the awareness of the student, or if you talk about whether this is covered in the syllabus, then I must say that this topic is definitely covered in the syllabus. Students know about this. They know that vehicles smoke is responsible, industrialization is responsible, urbanization is responsible, burning of fossil fuels is responsible, garbage is responsible. But actually, if you ask them, what is your role, what you are doing, they do not answer properly. They do not. And here we have to think of, there is a big gap which of the knowledge which they have and the knowledge which they actually need to acquire. And we have to fill this gap. We teachers, parents, society, everyone has to fill this gap. How can we do this? We have to teach them very small things of their own level, like switching off fan. They understand this. Use of bicycle, they understand this. Bicycle race, they understand this. If you tell them pooling of vehicle, they'll understand and they definitely try to use all these. If you tell them exchange plant as a gift, they understand. And on birthdays, they can exchange this in place of gift. That is a very good way by which we can train them to reduce air pollution. And we can create some kind of clubs in school. We also have one club in our school. We are working on this topic, air pollution, where not only the students, we can invite parents, we can invite society people, we can invite management and others also. Just call them, invite them and tell them to participate in this. So what will happen in this way? Students will be aware and a chain will be maintained. Parents will be aware from this, society will be aware from this. And this is very good way by which we can do this. They have knowledge. I must say that they have knowledge, but they do not have holistic knowledge. This thing is covered in the syllabus, but the syllabus is not updated. Whatever data they have, that is very old. And they need to know what government is doing, what is the level of pollution in the society, what is the role of NGOs in the society, what is their role. These all should be taught to them. At primary level, teachers can use storytelling. That is very good way. We can have some kind of games with them, art competitions, debates. At higher level, we can have other type of inter-school competitions, dance based on these themes, annual functions, one Mahotsav. These are all very good way by which we can train our children. I must say that if we start doing this training from the childhood, we'll definitely be able to mold our children. And we should inculcate all these habits in their daily routine. It should not be a burden. It should not be a burden of studies like theories they are learning, or they are doing some kind of work which they do not want to do. But if we change their daily routine, definitely they will be able to do some miracle in their life. And as far as the teachers are concerned, a lot of teachers are there. I feel those who are involved in this process, they should be trained properly. We should give proper training to them. And then only they can motivate children. Because if teachers are not motivated, if teachers are not updated, if they are not aware of the seriousness of this problem, they cannot solve this problem. So we must say that teachers, when teachers are playing such an important role, proper training must be given to these teachers. And then only we can understand this. Not only this, a lot of things are there. For example, somebody asked, is there any need to change the education system? Yes, there is a need to change in the education system. We have to update our syllabus as per the need of current scenario. Whatever the present status we have, based on that, we should have the syllabus. Syllabus should be very interactive and practical. They should do various activities based on these. If they are not doing, if they are not involved, they will never understand this. Some off-field training, some internship, these all things may be included in the syllabus. And for example, if a student visit healthcare center, visit of healthcare center may be very useful for them. If they visit this, they may understand the severity of this illness. If they visit any industrial area, they can understand what is air pollution and how they can control this. So these things are important and we all have to take care of this, and we have to train them from childhood. No, we should not think like when they grow up, they will take care of their family. No, not like this. From very beginning, even the teacher of primary level, teacher of nursery level, they should be very interactive, lot of dance themes they can have, lot of things. And parents and society people should be invited in a school regularly. If they are coming, they are watching these things, they can understand and they can put their hands to stop this. I know there are many schools who are doing a lot of one mahotsav kind of thing, inter-school competition, but that is not enough. Other schools should also come up, and they should also should take part in such kind of activities. Then only a time will come that we will be able to stop this, because this is very serious issue and we all must take care of this. And I must say that children are the best way, children are the best child stage. I must say that is the best stage when we can do some changes. Later on, it becomes very difficult. Later on, it's become like you can't do, you feel helpless. You feel helpless and you feel, no, ab to nahi ho sakta. That kind of approach comes. So we have to start this from the beginning. Students must involve themselves. Students must realize this. They should be motivated. They should realize this, and they should take part in all the activities which are going around them. I think.
Okay.
Yeah.
Thank you so much, madam. I think you rightly said that it has to be done now rather than later. Unless we start now with the kids at the younger age, it is not going to percolate further in their minds at a later stage. Let me move on to Professor Archana Kumar. Ma'am, I must say you have heard to all of us, and I don't need to tell that behavioral change is the key word here, and you are the expert. Please tell us what to do, and there are so many awareness programs happening here and there. We all are trying our best. Still, we are not able to percolate into the minds of people. As we have seen in all our surveys, maybe half of the people are aware and taking some actions, but rest half is still lagging behind. And this is what we are talking about cities where the awareness levels are relatively higher. So how to go about it? What has to be done in behavioral change communication field? Over to you, ma'am.
Thank you, Sumit. First of all, I just want to thank you for inviting me. I'm very happy. I was wondering about the panel. And now listening to everybody this afternoon, I think what I was planning to say, I'm going to change it totally. And I must first acknowledge Dr. Guleria and Dr. Sharma has already laid the foundations of what actually is behavior change communication. So today, first, I want to clarify to the whole group that what is behavior change communication and what are we talking about? And Dr. Sharma very rightly pointed out, today when Sumit, when you ask me that why are people not doing things that they are told, and I think we need to understand this, that the whole paradigm of how communications need to be structured needs to be has been revisited now, because we now well understand that many a times people know but they don't act. We tell them that this is good for you, and yet they still don't know do what we are asking them to do. And I think all the doctors are very, very well acutely aware of this fact, and that despite giving advice to people, they don't act in a particular way. So what we need to understand is that information does not convert into action. Now, if information has to convert into action, we need to look at and structure our communications in a different way. And this, I need to go back a little. And initially, most people think that communication is only telling people and giving them information. And if we can give them accurate information, they will adopt the right behaviors and they will do whatever we are advocating. But now the field of behavior change communication has clearly demonstrated that people do not act only on the basis of information that they have. People act on the context of their environments, their situations, the kind of situations that they are facing. All these factors come into play that influence what people's motivations are and whether they will be behaving in a particular way. Hence, that traditionally what we used to call information, education, communication, IEC, has now evolved into a field which we now call as social and behavior change communication. I think Dr. Guleria and Dr. Sharma very nicely pointed out that today when we talk of the challenge of air pollution and what needs to be done, we cannot just focus on the individual. The individual is a larger part of a larger context, and until unless we understand the context and we understand what and changes are brought at all levels, can we expect actual change to take place and improvement in the quality of lives of people. So the first thing we all need to understand is IEC, and just simply telling people and giving them information is not going to lead to change in behaviors. At this point, I want to point out to you what research in the field of behavior change communication tells us. I'm going to tell you 5 very key aspects, and I think understanding them tells us how we need to structure our communications. The first is that people give meaning to information based on the context they live in. So their context is going to define what is relevant for them and what is appropriate and meaningful for them. So I heard the children, and the two children were talking about that why does a person continue to behave in a particular way? We need to first understand their context. What are their lives all about? What is happening in their lives because of which they continue to behave in a particular way, and they are not willing to change despite knowing what is right and what is wrong. Dikshawalas know about it, yet they continue to do certain things which are detrimental to the environment. But we need to understand why. The second is that our behaviors are influenced by our culture and the networks of people we are a part of. So what we do and what we think is not just related to what we know, but it is also related to the context, our socio-cultural context, and the groups that we associate with. What do they think about the knowledge that is available? What do they believe? What are they advocating in the context of this? So all this will determine whether we will do what we are being told and what we know we should be doing. The third thing is that we should understand that when people make decisions, they don't always make decisions that are based on logic. Many of their decisions are based on emotional factors. And there are many other factors that can. So when we are communicating and we are logically trying to appeal to them, many a times our logic gets lost because simply that people don't their emotional factors come into play because of which they don't. And lastly, that many a times people's other priorities in life are going to compete with what they are doing, and hence their choices are going to be influenced by this. So when we talk of structuring communications around any particular issue, if we take cognizance of all these aspects and then we build our communications around them, we hope to then perhaps influence people and influence their behaviors. The field of behavior change communication has clearly brought out that if we have to influence behaviors, it is not only motivations, but also their capabilities and the kind of context and opportunities people have, which are going to determine. So it's a complex interplay of motivations, capacities, and capabilities and self-efficacy levels of people, as well as what kind of opportunities and contexts they live in, which will determine what they are going to be doing and how they are going to be behaving. So if a person, despite being told and despite knowing that they should be behaving in a particular manner, might not be doing it, not because they don't know, they might be doing it because either their context doesn't allow them to do it, the social or the economic costs of doing that might be too difficult for them or onerous for them, or simply because they might not feel efficacious enough to be able to do this. So when we design an SBCC interventions, we need to first and foremost understand what are the core principles, and we need to see to it that we have to articulate these into our interventions. And the first and foremost is that Dr. Sharma very nicely brought this out, that we all know air pollution is existing, we know it is impacting our health. Now, what is it that we want people to do? What is it that they have to do? We need to understand these behavioral outcomes that we are working towards, and we need to have clarity of these outcomes, and we have to design our whole communication campaigns around them. So these campaigns cannot be diffuse, they need to be pointed, and we need to be clear. The second important thing is that we have to understand and relate to people. We need to listen to them, we need to connect with them, and we need to understand that what are we advocating, what are we telling them to do, and how does it link to them and their lives, and most importantly, how do they perceive it. So remember, each of us, we have these weighing scales in our mind that we all evaluate any kind of message that is being given to us in terms of its pros and cons in the context to our lives. So when we are trying to communicate with people and we are advocating messages to them, have we thought about it? That how are people going to perceive it? How people are going to evaluate it? And what are the costs, both social and economic, that are people going to incur when they are going to follow that particular behavior? So behavior change communication requires a deep understanding of what is happening, what is it that people are doing, why are they doing what they are doing. And the more we can understand this, the more we understand what is it that we need to advocate to them so that they can change their behaviors and they can do what we are asking them to do. Some of the almost everybody said this, and I think one of the key aspects of behavior change communication is that we need to look at designing of these campaigns in a holistic context, but we also need to understand that we have to build ownership and we need to get multiple stakeholders to partake in these campaigns. And that is, it takes me to another aspect of what Dr. Guleria was pointing towards, that when we talk of SBCC, SBCC was a behavior change, social and behavior change communication, cannot just be targeting individual. It is a resonating process that has to look at the multiple layers of actions that need to be taken so that we can bring about. So why a person doesn't do something, it is not only related to an individual, the onus cannot be of an individual, but it could be because of bad policies, it could be because of certain organizations and institutions and their functionings and how they impact people's behavior. So we need to look at this full gamut of processes, and we need to align all these together, and only then. So SBCC theory tells us this clearly, that why people behave in a particular way might be also because of bad policy or a bad institutions and their functioning and the kind of incentives we are providing to people to act in a particular way. So when we design our SBCC campaigns, so though we are targeting individuals, but if we have not understood the larger context and we have not inbuilt these into our communications, we are not going to be very successful. And finally, when we talk of communication strategies and we talk of media and methods, increasingly, as was said by Vikrant, that we need to look at how knowledge is co-created. We cannot be prescriptive in our approach towards creation of information and knowledge, and we need to understand that people know and people also have perspectives, and how these perspectives inbuilt into the existing knowledge and the new knowledge that creates becomes the mechanisms of change. So when we are talking of channels and media and methods and techniques, so if in schools children are being told they should have, they're being educated about new practices and behaviors. Why are these important? Because we are laying the foundations of new value systems which are going to come into play in adopting new behaviors. So in the end, when we talk of communication should not be only seen in terms of media and a campaign that goes out, but needs to be seen in terms of the synergy between media that needs to be created so that we can influence. And in the end, behavior change communication is all about changing norms and changing values. And if we can change those, only then can we hope to have lasting change. But this lasting change will only happen if we are able to position our communications within the lives and contexts of people. And if we are not able to do this, we will not be very successful. So people will hear, people will participate, but they will never act on these. So if action is our sort of behavioral intentions are what we are wanting, and we want people to behave in a particular way, we need to design our communications in such a way that we are able to target all these aspects. The research that we have been doing in our department, looking at issues of air pollution and related to and what behavioral campaigns have gone about. Interestingly, I want to tell the whole group here that worldwide there are very few SBCC campaigns that have been done about air pollution. Our review of literature clearly tells us that there are very few initiatives, and I think the time has come that we move and focus in developing these concerted strategies that are able to bring about change in the lives, and we can really hope to bring about sustainable change. In the end, the basic mantras I would like to give is that before we design any interventions, it is important that we understand who we are reaching out to and within whom is it that we are wanting change. And we have to customize and tailor make our campaigns to suit and target them to the needs of these individuals. Secondly, we have to look at the larger organizational context as well as communities, and we need to create mechanisms that they can make choices and decisions about what needs to be done. So what might work in Delhi might not work in Pune, what might work in Bombay might not work in a smaller city like Chennai or any other city we are talking about. So we need to give greater flexibility and openness for people and organizations and communities to develop their own models as to what they need to do. The third thing that is very important is this whole issue of self-efficacy, and that people should feel that they have the confidence that yes, we can bring about change and we can act and we can work towards the goals that are being given to us. For this, we need to not only give people knowledge, but we need to build their capacities. And it is very, very important that we need to create networks where people can support each other and work towards these particular goals. And lastly, it's important that when we become part of, when we are designing behavior change communication programs, we must understand the costs of behaviors that we are asking people to do. So as I said, it is like a tarazu and everybody is weighing this, and we need to understand what are the costs and what are the benefits, and we need to understand what are the barriers that are coming into play. And through our campaigns, it is the barriers we have to target, and we have to provide knowledge and information, and our communications has to work towards removing these barriers. So the field of communication today is growing by leaps and bounds. There are multiple channels, methods, and medias that are available. So it is this eclectic mix of methods and media which are participatory, that help build self-efficacy and yet communicate and give us the knowledge that we need. It is this combination of methods and materials that we have to use. We have to target different stakeholders. And as some of the speakers were saying, these have to also address issues of social justice and the disparities that exist in our society. So we cannot have one solution for everybody. We have to look at the different segments of our population. India is a highly diverse, plural society where we have various segments of population, and their context and their circumstances vary. And we need to and we need to understand these, and it is within these that we have to provide work towards. I'm really looking forward to Dr. Sharma's report, where which will tell us whether air pollution cuts across all segments of society. And I have a huge hunch it does. But whether it does or it does not, the important thing is that we have to design now our communications that are tailor-made to the context and needs of these people and different communities if we are going to be successful in our endeavor to be able to realize those goals. So I'll end it here. And I think SBCC is a growing field. It is, and in the area of air pollution, there is lots and lots that needs to be done. We need to substantiate it with a lot of research in the field of epidemiology as well as hardcore medical research has to now get translated into behavioral outcomes and strategies that are going to bring about change in the quality of lives of people. So thank you so much for inviting. I've enjoyed listening, and I hope we are able to develop concerted strategies where different stakeholders come together and contribute towards bringing change within the society.
Yeah. Thank you so much, madam. I think it was a very comprehensive presentation, crisp and comprehensive about how to understand the context behind whoever we are wanting to change their minds. And I must move on. The time is very short. I'm going to give all the speakers last 30 seconds to say whatever they want to say, whatever their recommendations are, and we are going to compile and put it up as a report in the WSDS. I'll also throw some questions from the audiences. Let me first start with Dr. Sharma or Dr. Guleria if he's still there. The question is that, is there a direct link which clearly tells us that deteriorating health is only because of air pollution, as there are confounding factors which lead to, diseases of respiratory and cardiovascular systems. Your last 30-40 seconds, sir.
Is Dr. Guleria there and is he talking? Then
Dr. Guleria, are you still there? He had to go. I think, Dr. Sharma, you can carry on, please.
okay, so to specifically answer your question, I have just one point to make. For most of these diseases, which we know as chronic non-communicable diseases, the etiology of the disease is multifactorial. So air pollution is one component to causation of the disease. Whether you are talking about COPD, whether you are talking about hypertension, or you are talking about low birth weight and pregnancy wastage, or even it is the mental health conditions like attention deficit hyperactivity disorder, or it is Alzheimer's, or it is any other kind of disease. First, we have to understand that the biggest problem of our platforms where we discuss, when we are on a platform of air pollution and health, we try to think that okay, air pollution is the thing which is causing all the health problems. When I'm in a nutrition conference, we think nutrition is responsible for every problem of health that we have. Or for that matter, when we are in policy making decision, it is always said that it is illiteracy and poverty which is responsible for causing all the diseases. Now, we have to move from that paradigm and we need to understand that all diseases which are of chronic nature are multifactorial in origin. Air pollution contributes to it, illiteracy contributes to it, my lifestyle contributes to it, and my genetics also contribute to it. So what needs to be done? We need to identify how and how much contribution air pollution is causing and what should we do to at least reduce one risk factor. Out of a gamut of 10 risk factors, if I can eliminate air pollution, that much burden of disease will come down, which Professor Guleria was telling the numbers, that what number of disability adjusted life years lost, DALI lost, are attributable to pollution. How many premature deaths are occurring due to pollution? So if I remove air pollution, at least those premature deaths can be prevented. That much DALI loss can be averted. So we need to contribute towards removing pollution to carve out that particular aspect of it.
Right.
Thank you.
Thank you, Dr. Sharma. Let me move on to our young kids. Anshika, you want to say last few words? 30 seconds.
Yes, sir. Our society is lacking of awareness. Each of us knows about air pollution, but not all of us do anything for reducing it. Many scientists and organizations are trying to find out the ways to reduce it. They are working very hard and so can we. I encourage you all to reduce air pollution however you can. We can make some posters, do meetings in our societies to spread the level of awareness. We should try carpooling or should use public transport. We should post videos about increasing air pollution on social media sites to make more and more people aware about it. Government is trying their best to reduce air pollution, but we all are responsible for air pollution too. We also need to take some precautions to reduce it. We can walk or ride bicycles instead of using vehicles and not burn coal, garbage or plastic. If each of us will try to reduce air pollution, the world can be a clean and wonderful place to live. Thank you and Jai Jagat.
Thank you so much, Anshika. More voice, more strength to your voice. Bravo. Naman, all yours for next 30 seconds, please.
Sir, I would just like to say that God has given everything to all of us. He's not made any difference between us. And if we all of us stand together and we're united, we can easily defeat this cause and the air pollution levels will be back to normal. However, the points have to be abided by everyone out here. Thank you, Anjay.
there was a question on whether we can have, synergized plans for control of air pollution and climate change at the city level. Definitely, and it is the need of the hour with India signing the Climate and Clean Air Quality Coalition. I think this is the way forward, where we are going to have more synergized plan where air pollution control strategies are going to benefit on the climate change side, and the low carbon trajectories are going to give co-benefits in terms of air pollution control. I think we all will see this happening in next 5 to 10 years in the country. Let me move on to Mrs. Archana Khanna Chabra. Madam, all your last words on this panel, please.
Yeah, one thing I want to say that our syllabus should be updated as per the need of ours. Secondly, teachers should be trained properly so that they can motivate children properly. And a third thing, we should try to teach children in such a way that they can change their daily routine. Things should be involved in their daily routine process, whatever they are doing, like ban on plastic, use of cloth bag, use of cycle, pooling, these all should be encouraged. And the system, education system should be based on more practical and interactive activities. So that is very important. Otherwise, they will not understand the importance of this and they will not be able to come forward, and we will not be able to start this at early stage, because childhood, as I told, is very important stage. At this stage, we can start controlling this air pollution and we will be able to do this. Thank you, ma'am.
Thank you, Madam. Dr. Archana Kumar, Madam, your last words with a question.
Sumit, I think listening to everybody, Terry has a huge responsibility. You need to now create a behavioral outcome matrix for different levels of interventions that you are going to require. I think in behavior change communication, we use what is called the socio-ecological model, where different levels of interventions are required and a synergy is needed. So you need to create that matrix as to what needs to be done at what level. And if that can be communicated to different stakeholders who are going to be involved in the communications and interventions, they will know exactly what is required and what are we targeting towards. Because if we are not clear of what we are targeting, so there is no debate that air pollution is not causing a detrimental impact. I think that's a given, that is accepted worldwide. Everybody is agreeing to that. Now comes the second stage, that okay, now if that is done, what needs to be done now? What needs to be communicated to whom? What is the change that we require? Is it a policy? What kind of policy is it requiring in terms of intervention at the community level? What needs to be done and what do individuals need to do? So whether it is we are talking about schools or young people, they get a clear directive. Similarly, we need to give directives at various levels. I think organizations like Terry have to, and this has to be now an integral part of the project that you're doing. I think if you can do that and create that matrix and then experiment with this, you would do huge service to the whole cause of air pollution in this country.
Thank you so much, Professor Archana Kumar. I think, we have registered, we have noted your points, and we'll be in touch. I will not even attempt to summarize what I have heard today. And I have learned so many things, so many perspectives. Naman, Anshika, you keep on raising your voices and raise the demand for good air quality. As we demand good quality of water, as we demand cleanliness around us, we have to demand good quality of clean air for all of us. Dr. Sharma, Dr. Guleria, I think you have been the workhorses, I must say, behind taking the research forward, linking air pollution with health. And unless this link is established, this link is understood by not just people like us, but all the policymakers, we are not going to see the strongest, strictest actions on air quality. Madam Archana Khanna Chabra ji, I think your comments were very substantive on the need for the changes in the educational systems. I think the point is well made, and we have made a note of it. Dr. Archana Kumar, and we have heard you how important BCC is, and we need to keep integrating it in all our awareness related programs in TERI and in all the other possible NGOs. Vikrant made a very strong point on why, he himself acknowledged that, media is only reporting in winters and not reporting in summers. I think he clearly asked for stronger action from all the, agencies, stakeholders which are involved. I would like to say one thing here that, enforcement will take some time. Government agencies are working, research is happening, and I think we all demand it to happen at a fastest pace. But this is going to still take some time. We have to, in my opinion, activate our self-enforcement mode. Unless we ourselves are responsible for our contributions, we cannot just demand everything from others. So we need to, maintain our vehicles. We need to use low pollution product. Low VOC paints is one example. The devices which are more energy efficient. And above all, we must start demanding good quality of air. As we demand good quality of water to our politicians, this becomes a political issue. But why can't air quality become a political issue? And one reason for that is we are not using our awareness level to raise this demand to the politicians or the policymakers. So with this, I thank all the speakers for their time and very substantive inputs in this session. And I thank all the participants, and I hand it over to Varsha for the conclusions. Anju, you can give the vote of thanks. Yeah.
Okay, Sumit. Yep. It's a great. Hi, good evening, everyone. I'm Dr. Anju Goyal. I work as a fellow at TERI. Well, it's a great pleasure and privilege for me to be part of this initiative, and to also extend the vote of thanks. First of all, I would like to propose hearty vote of thanks to Swiss Agency for Development and Cooperation for supporting CAP India project. Special mention to Dr. Jonathan Demenge, Dr. Anand Shukla, and Mr. Fink Endrin for their constant support in this regard. I would also like to thank MOEFCC, Maharashtra Pollution Control Board, UP Pollution Control Board, and local stakeholders of 4 focus cities for supporting the project activities. I would like to thank all the eminent speakers, Professor R. Guleria, Professor Arun Sharma, Professor Archana Kumar, Mr. Vikrant Gupta, Ms. Archana Khanna Chabra, Mr. Naman Sahane, Ms. Anshika Maurya for gracing their crucial work and sharing with us their opinions and findings of their research, which made the event very informative. Thank you very much. Thanks are due to Dr. Ajay Mathur, Director General TERI, for providing constant guidance, support, and encouragement. I would also like to thank WSDS team for providing logistic support for the event. Thanks are due to CES team and EA team from TERI for their constant efforts in organizing this event. Last but not the least, I sincerely thank all the delegates of this webinar for showing their interest to participate in this event and provided their valuable contribution in one way or other in making the event a grand success. We are looking forward for your presence in upcoming events tomorrow and day after tomorrow as well in the summit. Thank you very much.